All right. Glad to be back doing another episode. I feel like it's been a little while since we've done one. Well, I think it actually has been a while since we've done one. Today, we're talking about how we use technology in our work at Revive. Well, for starters, we're using technology to make an episode about technology. There you go. And end of episode. We can finish the recording now. Um, so, what I thought we would start with is well, I mean, there's a couple different ways we could start it, but why don't we start by going through a list of challenges or worries that people may have around technology when it comes to nutrition coaching or counseling or this type of service that we provide people where there's a lot of interaction. Uh, there's a variety of things that we've heard from people around what may worry people, or I could say worry people, or we could also just say that makes the experience less enjoyable, or hesitations that people may have with it, or barriers that people may have with it. Any synonym that we could potentially use. And then let's go through afterwards a list of benefits or ways that we work around these challenges, or benefits that may outweigh said challenges. So, what comes to mind first? Andrea.
Um, yeah, I think the first thing first, if anybody is actually listening, and we're not going to touch on anything today, we'd be curious to for you to leave a comment on how you feel about technology or your experience around technology and in care, so we can um, speak to more of this because I think with the pandemic really pushed a lot of new technology into this space. There were some people like Revive who actually had already this technology in place, but just more of a higher user of it. So people were really very quickly pulled into a digital world for a while, and not that's not everybody's comfort zone. So then you start to hear about the worries that come with it, when it's being pinned against what would be maybe considered traditional, or what they're used to. So I think the first thing that comes to mind is there's the perceived notion that people are not going to have a good experience, whether they feel that that person isn't a real person, but just that feeling of, you know what, it's not going to be as good because I'm not sitting across from them. And I think that's a worry we have heard in Revive from people.
Hmm, fair. Matthew, what do you think?
Yes, that is one that I have heard before. And on top of that, another common one is just worries of using the technology itself. So, whether that be through the virtual sessions where it's through Practice Better, just being used to or getting used to using a new software, even if they've done something similar with, let's say, Zoom or something like Google Meet or Google Hangouts, the addition of a new platform, even if some things are similar, can present a challenge for some people or can present a worry that it will be a challenge.
Yeah, the thing that I hear of like, I need another app. And I mean, in today's day and age, it's kind of hard to do something new and different without having to use another app, another platform. And I think that's just how things go sometimes. Um, and there's definitely different skill levels of different technologies. I mean, a lot of people are aware of Zoom nowadays, but I mean, we don't use Zoom, and all platforms kind of have a similar-ish vibe, but the buttons are in a different place, or how you enter the thing is in a different place, or it's just things that are slightly different or different enough to make it so that you have to think a little bit harder when you're using it, um, or you just may not be used to it. So, I mean, yeah, there's any number of things that could come up. Um, what is the has anybody started working with you and then they actually stopped because the technology component was too much of a barrier? Has that ever happened?
I can confidently say that I have not stopped working with a client due to the inability to continue with sessions. I have had the hesitation coming in of, you know what, I'm going to see what this is like and see how it feels. So the hesitation around it. But I have not had a client say, you know what, Andrew, I'm not going to work with you because you're in a digital space. Um, and part of that comes from that perceived notion of it's not going to be the same, or a good experience. So there's hesitation, 100% comes in with it, but it has not changed the outcome. If any, it's brought up more of the benefits that they're noticing with it or that we have talked about. So it goes from kind of hesitation to actually it ends up being a benefit, if anything.
Yeah, that has been my experience as well. Maybe sometimes at the beginning there are worries. They're thinking, okay, maybe in the end we'll end up doing maybe phone appointments or in person. But even if that very first session is somewhat of a challenge, or the discovery call itself is a bit of a challenge, it tends to be easier the second time around and then
Yeah.
continues to not really be much of an issue. And I find that sometimes the worries themselves can be stronger than the challenges that actually do come. So I'm glad that for me as well, it has never actually gotten in the way of continuing with services.
It's the fear of the unknown, or the worry about the unknown. We're like, well, and I guess also another thing is, I guess people may have had a previous experience with technology in some way that wasn't super good, super stellar. You know, maybe they were with a different provider and they just sucked, or you know, their workplace doesn't use it well, or you know, whatever else. Preconceived notions that are out of our control may factor in. I think with all of this said, though, at least in the time that I've been a dietitian, I've seen both worlds, where there was a less digital approach moved to a very digital focused approach. And I may be biased, I don't know, but I feel like there's more benefits than there are challenges. Even once we get people used to and accustomed to the process, there is a ton of benefits that are, I mean, depending on the person, but I feel like quite consistently for most people. Wouldn't you guys say that would be the case?
Yeah, I would for sure. And I have been in both spaces where there wasn't even a different option other than in person. So I've been on the opposite end of that. That was the only option, which then can lead to some of the benefits or the open doors that technology does have. And I think the fear of the unknown is a big piece of that, because we do have um, a feeling of technology not being real, or not being who they say they are, or whatever. So yeah, it's actually quite an exciting time to see how healthcare professionals, including dietitians and coaching and stuff, are using technology, because I think it's exciting how we're changing access to healthcare.
And I mean, there's a lot of movement. There's a quick movement in the area that some teams transition to this, and depending on the system that you're accessing. But I know one thing that has come up that can be a challenge or a worry, and also a benefit, is privacy and security. Because as healthcare professionals, of course,
Yeah.
we take this point very, very seriously. Um, Matthew, I think you had a point to mention on this piece. What are your thoughts?
Yes, I wanted to mention security just because, like you said, it can be a concern when it comes to online practice, because uh, there are some notable examples of like data breaches, and some specifically relating to healthcare services. Like some people may have received one of those mass letters last year pertaining to breach of some information pertaining to dental services in the province. And yeah, I just wanted to mention that, like you said, we do take this very seriously. And at Revive, we make sure that we are using software that is compliant with different requirements, whether they be specific to providing healthcare services or they are other cybersecurity frameworks that we abide by that actually go above and beyond what is the minimum, just so that we know that people's information will be safe. We know that people's, because it is sensitive information, whether it be the health information itself, the personal details like address, phone number, all the contact information. So we do ensure that that is all stored very securely, and we value that in our practice.
Yeah. So for those that don't know much about this area, there's very strict criteria that we have to adhere to as healthcare professionals that protect health information. So if you've ever heard of HIPAA compliance or PIPEDA compliance, depending on where you're located, but to Matthew's point about additional certification or additional frameworks that we can use, there's a number of them, and it does kind of depend on where the data is being processed and housed and such. You had an example of one, right, Matthew? I think.
Yes, just to expand on what we use specifically. Our company is SOC 2 compliant, and this is Service Organization Control. And this is just in, like we said, it's more of an above what those minimum requirements are, specific to how data is stored and how data is processed as well, just to make sure that people's information stays safe. Make sure that people's information is safe and secure in a way that when these things are not followed, even if they do meet like the minimum requirements, this has led to some of those examples we mentioned before in terms of data being leaked. So this goes well beyond that to have that extra layer of security and privacy for people's information.
Never be too safe. Never be too
No.
safe.
And I think actually that, that does trickle down. So as a company, we hold that. But I know I also have lots of conversations with my clients of, even though we're in a digital space and you can see me technically anywhere, which is a benefit, you still need to protect that digital space that we would have in a clinic or in-person setting. So even protecting your own digital space, is there a closed door? Are you having this conversation with me in a place that's not open to coworkers and you're in a secure, secure room? Or my goodness, I know we've had lots of conversations of asking people to, pull over on the side of the road and not take our call just because you can, because it's more of a safety thing. And I think, we have all the things in place, but it's also a responsibility that we've taken on to start to teach our clients of how they can participate in a safe digital space too, because it's the safety and privacy is top importance.
And at the same time, although there are those extra security features, we still make sure that that information is available and accessible through that platform for people to use. So at the same time, like you said, you can never be too safe with extra security, but it is important that that extra security does not excessively get in the way of actual access of that information or being able to communicate effectively and quickly with these services. So that is balanced in the usage of some of these software and processes.
And ultimately, I think with any additional security features or, going beyond just a strong password, like there's a lot more that could be done, even if you're not aware of it. But ultimately, when you get used to the processes, I mean, there was a point in time where, two-factor authentication wasn't really a standard across industries, and now it's very much a standard. And so, an additional step that originally felt kind of like a pain or a nuisance is now like, well, I'm kind of used to it now. And so you come to expect some of it. So I guess it does depend on where people are coming from, because if people are used to an environment either at home or at work that doesn't really do much of that, versus people that, I can think of the easiest example of somebody that works in tech somewhere, they're used to that type of a thing, and they're like, oh yeah, I wouldn't expect anything different. So let's dive into some benefits of technology. We already kind of we scratched the surface a little bit, but in terms of why, and I'm thinking of the clients that I've talked to that kind of preferred this over in-person services. What things come to mind with why using technology may be better in terms of what we can provide people, whether or not they're actually doing online appointments, or maybe, if there are, what does this allow us to do as not only healthcare professionals, but as Revive, as dietitians, when we're working with people? Why is this a benefit in the first place? Whoever wants to go.
I can start with some of the convenience aspects that we mentioned in the last episode. So one is just the virtual nature allows us to reach people in not just in Edmonton or not just in South Edmonton, but people across Western Canada. Some people in Saskatchewan, Alberta, British Columbia, who otherwise wouldn't, who otherwise would not be able to see us because of distance. Another thing is that even if you are within the same city or even closer in the same part of the city, it is still very convenient to be able to do things virtually, both from the perspective of just saving time, like the total amount of time is less, but there's less of a need to just break from other things like work and trying to be able to fit that in throughout the day or throughout the week. That's a lot easier when it comes to a virtual practice, where maybe something during a lunch hour is more convenient for you, or something in the evenings when a lot of other virtual appointments in the evenings when a lot of health clinics will not even be open. Their business hours are the same as yours, so you have to take some time away. We also have the availability and convenience of being able to offer even weekend appointments through virtual practice, and I'd say that those convenience factors are huge. And one more thing there that, again, we touched on in the last episode is those in rural areas where, again, maybe distance is an issue, or maybe just where you're more limited in terms of the health services available to you. You can have the additional options that come through using virtual services like this one.
Amazing points.
Yeah.
Andrea?
A few more to even add to that list. If we look at the cost, so cost is always an interesting conversation, because the cost of somebody having to take off work from an appointment, or travel, or gas, or needing to even hire a babysitter or childcare, or whatever during that time, that starts to add up. So the cost benefits allow a lot more of that to happen. And when I think about, for people living with chronic disease, a lot of time actually is taken away from work just to be able to attend appointments. So to Matthew's point of we have a lot more flexibility, is we're even able to hop on with you during your lunch break, or in the evening, so you're not having to take that time. So the cost, and I also think of cost of quality of life, because I don't know about the two of you, but I would be shocked and amazed if you've ever had to go to an appointment and literally sit for you know 30 minutes to an hour and a half before you get to see somebody, where that virtual appointment, when I think about cost, is like effectiveness of time, is your time is actually a little bit more better use. That's terrible grammar. So yeah, to the cost of your overall day, or overall well-being too. So I think that's an important piece that we don't really talk about. The other piece, which I find really interesting, probably more because of my niche, is around accessibility. So, some people, that comfort of being able to do an appointment in their home, maybe they've had an experience where they're judged for whatever reason, or they're going to a space that doesn't have, chairs or railings or ramps or the appropriate equipment. If that could be a barrier to care. So technology actually opens that um, comfort for a lot of people. Um, and some people, I've even seen this in person and not, is we're more likely to open up and share when we feel comfortable versus I always think about going to a medical appointment and sitting under the bright lights and it's cold or whatever and it's busyness and you're just maybe drove really quickly and you've had a lot on your brain because you were running late, which can affect that experience too that you would have with that provider. So that comfort, if you're a parent and you've got your kids running around, they can be in their same space versus having to lug them to an appointment and just I don't know, as a parent myself, it's like bringing my kids to an appointment and having them run around and terrorize everything and lick things and touch things, and your mind is there. So the comfort and accessibility piece, we underestimate that, I think, sometimes.
Yeah, I mean, even though the office space at Revive is, I would say is more on the comfortable and, chill side of things. It's not as sharp of an experience as like, a Medi Center waiting room. But still, I mean, like you can be in the most comfortable place and have massage chairs for, we don't have massage chairs, but for example, and there's still that element of, I just, there's something about being home. And of course, that's not always the case for everybody. Maybe home is actually not a good place for some people.
Yeah.
You know, that is valid. So that's something to consider too. But I definitely agree, and I've heard that from many people about, like, I don't have to go anywhere, and depending on the time of year, ain't nobody want to drive in like snow and stuff like this if you don't really need to. If you can do the same thing and not have to leave and go outside, and all that takes extra time, so on and so forth, then that's a bonus. That's a value add for a lot of people. And if that decreases the barrier to accessing our services or any service in general, then that's huge.
I also love, and I've had some clients comment too, probably because of the nutrition component hat that we wear, right? Is clients can show us things in their home if that's what their comfort level is, right? Right? They can pull things from their fridge and be like, Andrea, like, what do you think about this? And, this is my kitchen space to work with. This is what I'm struggling with. Or, um, the medications or the vitamins or maybe other things that people are taking that they're not going to bring with them to an appointment. They'll be having to bring a suitcase sometimes. But that's then the relatability of, we can not see what you're doing, because I don't want that to come across as like we're watching you, but to come across as like that's really easy then for those conversations. We're not guessing, and it's in real time. Yeah.
Yeah, I think the point you mentioned on like needing to bring labels and such is a very good point, specifically when it comes to chronic disease management, because a lot of people, it's not going to just be like one medication. It's going to be taking a higher amount and needing to either like remember to bring all of them or write down a huge list and make sure that everything is dosed and written correctly, when you can just go to the other room, get the bottle, come back, and like you said, not guessing. It's right here. Might be like hard to pronounce or read because they like to name things like that, but we're able to figure it out and we're not guessing based off of just what we may or may not remember.
I think actually that brings another point, is that the accuracy of the information that we discuss can be better. Like, you can be more accurate. Like, you can go into the room and grab something as opposed to trying to remember what it is. And then you could potentially get it wrong. And then, oh, can you send me a picture afterwards? Or like, can you bring it next time? Or something like that, even down to something like, speaking of memory, like food journaling. Like, technology we uses in an integrated food journal. So then you don't have to guess and rely on memory, and we don't have to ask you thousands of questions in a session about what you had because you already have it stored somewhere in a safe location that's integrated with our work and our sessions. So like you don't have to guess, or you don't have to misspell, mispronounce, or especially for things that are complicated. Heck, the amount of times that I've like tried to remember a product that I was trying to explain to a client, and I couldn't think of it, and because I couldn't remember it, I didn't know what to search on Google to know to bring it up to share my screen with them, but I had it in my fridge downstairs. So like, hold on a sec, I'll go grab it. Like if we weren't doing this virtual stuff or using any technology, like it would be like, oh, I have to wait and send that to you later, which is fine, but it's definitely nice. It's kind of fun in the moment. And it also, if it's in the moment conversation, it's going to be more effective to discuss whatever that may be, I find.
And I think you can even take that further, is because a lot of times, I mean, if I think about traditional, right, we would write what you were supposed to do and, take a handout and away you go. And a lot of times after a point was like, oh my gosh, like what did we talk about, or what am I supposed to remember from this? And the technology that we use allows clients to go back and look at everything that we've talked about. So a lot of my clients are pulling up their stuff from before and go, oh yeah, you and I talked about this and this and this and this, and how is that going? So I think it also helps with encouraging people to kind of take responsibility of those, or being empowered to be able to go, yeah, this is what we talked about and this is what I'm walking away with, and it's housed in one place. It's not under my stack of papers of all my other things that need to be filed away, and where is it, in the dog ate it in the recycling bin, right? So if I think about that health component, technology really can help keep a lot of that. And I do have clients to go, you know what, I went back on all of our notes to walk through everything. It's like that was done on paper. They don't have that opportunity. So it even leaves after the appointment as well.
Yeah, I love the relief that you can see on some people's face when you let them know you don't need to write this down or remember all of this,
Yep.
or like write everything on this handout or this document. Well, yeah, we can just be more in the moment and talk about the
Yeah.
concerns, and then we can send all of this stuff afterwards.
Yep. Totally. I've I I've seen that too with some of my clients where you can see them writing frantically. And you're just like, I got it. I'll send it to you
Yeah.
afterwards. Unless you really want to take your own notes. Some people like to do that just
Which,
because that
yeah.
helps them process information and stuff. But yeah, the ones that were just
Mhm.
like they're super stressed and then you just see it just like it's like, hey, we're doing something right. Love it.
Mm-hmm. And another point on just relating to efficiency that is nice is just people being able to fill out some of those like pre initial assessment forms beforehand, so that we're able to spend more time on the actual concerns and not needing to just collect information that could easily be done beforehand and just maybe verify a couple things. It saves a lot of time in that way too.
Absolutely. Yeah.
I think, Matthew, that speaks to, what people's worries are, is they're not going to have a good relationship conversation. And I think that stems a little bit from traditional, right? Is we have to do so much information gathering because we have no other way to get it. And then that falls into, well, I've already told this story before. Like, why are they asking this? Or like, I just want to get into what it is I'm here for, what it is I'm, wanting to get out of this. And I think I can speak for the team is the are and is it technology, although we think is going to change that experience, you're still talking to really great dietitians on the end who really believe in that holistic approach, and you as a human, and they're coming with empathy and compassion, and that's something that's not just a worry with technology. People can maybe not get that same type of care. So it speaks to what we've spoke to in other episodes of, finding that right fit to keep that experience for you. I think as well.
Agreed. Yep. 100% agreed. Well, and I think what we should do, because there's a lot more than just the experience itself. Like we use many different programs in our work with our clients. Why don't we? I think this would be an excellent place to leave it and leave the like, what more can we do? Like what components? Because there's some people that might listen to this, watch this, and say, well, okay, yeah, but how's that different than any other person that I would go that's using a similar type of platform, whether it's the same one or not. But there's pieces that, I would argue in that case that, it takes a lot of diligence to do it well. Because, yeah, everybody can set up a video chat online, but like to make sure everything is smooth, the experience is solid, all the little things that go in behind the scenes to like have the forms sent to you on time, actually looking at the stuff, like the food journal piece, all of this, like allowing you to reschedule appointments and you don't have to contact us and go back and forth with that. Like, is this time available? Are you free this time? No, I'm not. What about this time? Like those pieces, like once you have a system set up for all of those, that makes you can manage those things yourself more and add that one more thing to the list of things that you have control over. But there is a lot more that we can go into that I think would be perfect to go into in the next episode around things like My Viva Plan, body composition analysis, wearables. There's probably more there that we can go into that all feeds into this experience of using technology in our practice. That is I think a good place to go next. That would result in not an hour and a half podcast episode today. What do you think?
I agree.
That's a
Yes.
good idea.
Cool. All right, we'll leave it there for today. As always, hope you enjoyed the episode today. Make sure you like, subscribe, share, whichever platform this ends up where you're watching this or listening to this on. And I look forward to the next one where we'll dive a little bit more into technology at Revive.